Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Science and Pharmacy in St. Louis with their podcast titled Dose of Knowledge. We give credit to Professor Stephanie Lucas and Terry Wahalik for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Now let's hand the microphone over to our students.
It's October 2nd, 2017. My father received a call that changed our family forever. The words, "Dylan's dead," echoed in my ears, and panic ran through my body. My cousin had overdosed, and although there is a drug that could have reversed it, Narcan was not used. This tragic moment is exactly why naloxone matters. Today on Reverse the Crisis, we're talking about why everyone should carry it, how it works, and how it can save lives. I'm Olivia Heffley, joined by
Anna Anderson,
Reese Hampton,
Lucy St. John,
and Caitlin Hamill.
And we're second-year pharmacy students at the St. Louis College of Pharmacy. Let's dive in. Stories like the one I just shared about my cousin Dylan are far too common. In fact, opioid overdoses have become a nationwide crisis, affecting people of all ages, backgrounds, and experiences. To give us some perspective on the scale of the epidemic, Reese will walk us through the current crisis in the U.S.
Thank you so much for opening up about that, Olivia. We appreciate you sharing your personal story with us. Now let's take a closer look at the numbers behind the crisis. Here are some key factors that were taken from the Center for Disease Control. More than 100,000 people in the United States die each year from overdoses. The opioid overdose death rate has declined 4% from 2022 to 2023, and overdoses are the leading cause of injury-related death in the United States.
So, Reese, looking at all these numbers, what is the main culprit behind most overdose deaths?
It's fentanyl, a very strong opioid. It is found in most overdose deaths. Most fentanyl-related overdose deaths are related to illegally made fentanyl, not the pharmaceutical fentanyl. Many illegal drugs are now being mixed with fentanyl, and this is where much of the illegally made fentanyl is found.
Got it. And who is actually affected by this crisis? Is there a certain group of people?
It's everyone. Overdoses do not discriminate. They can affect adults, teens, those who live in the city, and those who live in rural areas. This is why the awareness and access to Narcan is so important.
So now that we understand the scale of the overdose crisis and the role fentanyl plays, let's talk about what Narcan is and how it can save lives in these situations. Anna, can you walk us through that, please?
Absolutely. Naloxone, which is also known as and will be referred to by us and many other people in the health profession, is Narcan. It's a medicine that wakes people up and helps them breathe again when they overdose. It works quickly and is very safe, even if the person hasn't taken opioids. Narcan won't hurt them. If Narcan was dispensed to me right now, the only side effect I would experience is a wet nose.
So Anna, is Narcan kind of like a safety net in case of an overdose?
Exactly. Think of it as like an emergency tool that can literally save a life in critical moments. Now, it's important to also remember the warning signs of an overdose so you know when and how to act. Some of the most common signs include very small pupils, so little tiny dots in the eyes, slow or no breathing, not waking up when you call their name or when you shake them gently. A good acronym to remember these signs is PIN, P-I-N. P for pupils, very small, I for insufficient breathing, which is slow or not there at all, and N for not responsive, can't wake them. It can be overwhelming, but a safe rule of thumb is if a person can't wake up and is breathing slowly or not at all, you should be prepared to use Narcan immediately. The National Harm Reduction Coalition, which we'll have linked in our show notes, has great resources for remembering these signs and taking action. So, Narcan is safe, it works quickly, and now you know how critical it is to recognize the warning signs, PIN. Next, we'll dive into how to actually administer Narcan so you can be ready if someone you know ever needs it. Lucy, do you mind walking us through this?
Not at all. Thanks, Anna. So recognizing an overdose is only the first step. Let's go over the different methods and tips to make sure that it's done safely and effectively. If you ever find someone who might be overdosing, don't panic. You can help save their life. Now we will talk about what to do step by step. First, try to wake them up. Shake their shoulders gently and call their name. Sometimes people will respond, but if they don't, call 911 right away or designate someone else nearby to do so. It's super important to get emergency help on the way. Next, grab your Narcan spray. It's simple to use. You don't need to put anything together or measure anything out. Now, tilt the person's head back just a little bit so their airway is open. Then you're going to place the tip of the Narcan spray into one nostril and press the plunger all the way in. One quick spray. Wait about 2 or 3 minutes, and if the person still hasn't woken up or started breathing better, use a second dose of the Narcan. The great thing about Narcan is that it's very safe, like Anna said. Even if the person didn't take opioids, Narcan won't hurt them. It just helps restart their breathing and gives them a second chance to survive. We also have a link in our show notes so you can check out quick, official instructions on how to use Narcan. It only takes a few minutes to learn, but it can make all the difference. Now, something important to remember is that Narcan can wear off in less than an hour. So even if the person wakes up, don't leave them alone. Stay with them until EMS arrives. And when they wake up, they might feel sick, dizzy, or confused, but that's normal. And the important thing is they're alive, and you help make that happen. Afterwards, they should see a doctor to make sure that there's no organ damage. The healthcare team can also help create a plan to prevent future overdoses. Remember, knowing how to use Narcan doesn't just make you prepared. It makes you someone who can truly reverse the crisis.
Now that we've talked about the overdose crisis, how Narcan works, and how to use it, we wanted to bring in an expert who deals with this every day. Joining us is Jenny Armbruster, the Executive Director at Prevent Ed in St. Louis. Jenny has been with Prevent Ed since 2007, bringing more than 22 years of experience in social services. She oversees the organization's counseling program, certified peer specialist services, and community prevention and education initiatives, and which brought her here today, including the opioid, education, and naloxone programs. She is passionate about prevention, recovery, and helping communities thrive through education and support. Fun fact, she actually has her own podcast called The Preventable that can be streamed on any of your favorite streaming platforms, including Spotify and Apple Music.
We're so happy that you could be here today, Jenny. To start us off, could you tell us a little bit about your background and how you first got involved with Narcan and overdose prevention?
Absolutely. Thank you for having me here today. As Reese shared, I started at Prevent Ed in 2007. So as a prevention and community outreach organization, at that time we remained focused in our school-based prevention and community prevention efforts, along with helping people identify maybe some paths for recovery services. In about 2016, Narcan, of course, was around in communities at the time, but not as widespread as it is today. We were fortunate to be able to partner with some other organizations locally and receive some funding to start some more widespread overdose education and naloxone distribution. So since that time, we've just continued to really ramp up those efforts, providing the training across different sectors, distributing naloxone in different ways, different types of naloxone, everywhere through community organization distribution to mailing naloxone to having vending machines where people can come and pick up naloxone 24/7.
Could you tell us a little bit more about the vending machines with the Narcan and how that came about and how people have access to that and what it would look like cost-wise?
Absolutely. So we started as an organization, so we really serve the entire eastern region of Missouri, which includes 7 counties, so St. Louis City and County, and then some of the outlying rural counties. One of those being Franklin County, which is just kind of southwest of the St. Louis metro area. And in that community, again, we had some funding opportunities and really a lot of community support, looking at ways how we could better distribute naloxone. As a more rural community, some of the naloxone distribution efforts there were sometimes difficult because if people couldn't get to certain locations or certain places were only open, during business hours or those kind of things, we were looking for some other options for people and had the opportunity with community community partnership to place 3 vending machines. And we call them vending machines, but because they look like vending machines, and that's what people are most familiar with. But really, they're set up similar to where you might get your snacks or your favorite drink. But they contain naloxone, they contain medication disposal bags, fentanyl testing strips, and they're no cost. So people can come, you just kind of put in the number, or you can open the doors and be able to access the product that you need. The machines themselves cost a few $1,000s each. There's really fancy ones, there's pretty basic ones. It just depends on where you want them to go, whether they need to be climate controlled and what size, and all of those kind of operations with the vending machines. So the cost of the machines themselves are not extremely huge, but then it's just the cost of the material to keep them stocked.
So how often and kind of what does the process look like with restocking those machines?
So the 3 we have in Franklin County, and then we also now have 1 at our office in St. Louis County. Of course, there's many other organizations that have them throughout our communities as well. For Franklin County, we're very fortunate that we partner with one of our local community coalitions there. So they have a team of volunteers that were really passionate about this project too. So they are able to be the ones, they have volunteers that regularly will just, go check on the machines, make sure they're stocked, make sure there hasn't been any, damage to them in any way, make sure that, they're ready to go for whoever needs them. So that is completely run through volunteer efforts, which is fantastic. Of course, the one at our office in St. Louis County is easy. We have staff there every day that can kind of keep an eye on it. We've also done some work with the Nalox boxes, which are they kind of look like AED boxes that can hang on walls and have naloxone available in those as well. With those, we've also included a QR code when they need to be restocked so that we're able to do it that way too.
Very nice. Okay. And then where is most of the funding? Is it through donors? Is it through grants? Where's that funding coming from to be able to provide the communities with these vending machines?
Most of the funding comes through grants and contracts. So that will look a few different sources. There's been some streams of federal funding that has come down through the state. There has been some local funding that's available, and also opioid settlement dollars that have been available. Really, the opioid settlement dollars at this time cover the cost of the majority of the naloxone itself.
Awesome. And then I think Caitlin and Lucy have some questions they wanted to ask you as well.
Yes.
Okay.
So it seems like these resources are being used across the areas where you're distributing. Have you noticed either statistically or just generally changes in the outcomes within the communities based off of these resources?
Yes, I think it's been very promising and very encouraging that in the last couple of years, so when we look at data from 2023 and 2024, we are seeing significant declines in fatal opioid overdoses. So declines in deaths related to opioid use, which is, like I said, very encouraging. Up to rates of 30 to 40% in communities of reduction in deaths. Again, there's not one magic answer to opioid crisis or opioid epidemic, so we cannot just contribute that all to naloxone. But if we talk to the researchers that collect the data and we look at community efforts, we know that a large portion of this is the just availability and the distribution of naloxone in communities. I mean, if we graph this out, we see more naloxone being distributed and less deaths happening. So we know there has to be a connection there. This has to be one of the strategies that is contributing.
Well, that's great.
Yeah.
That's great.
Yeah, and then I just had another question. What are some fears that you've kind of heard from people as to why they might not want to use Narcan?
Yeah, so I think, one of the most common fears is people's reaction. So the person who has experienced the overdose, their reaction if somebody administers naloxone or Narcan to them, will they be combative? Will they be angry? And that just is really not found to be true. That's something that's portrayed in movies and dramatized in a lot of ways. But, typically with naloxone, people, and the environment in which they, kind of become aware again of their surroundings. If the person administering the naloxone is calm, if they're, telling them, I've administered naloxone, you were experiencing an overdose, I'm helping you to breathe again and get help. There has really rarely been a time when somebody might be angry or combative. Now, if they're in withdrawal symptoms now, if the naloxone has caused some withdrawal to happen, they might not feel really great, but they're usually not going to be violent in any way. Right. So that's a big concern. The other concern from community members, so, in distribution efforts, we talked a little bit about the vending machines already, but there's also smaller, people call them, naloxone mailboxes or, kind of other smaller distribution boxes that are commonly put sometimes at churches or at other community organizations. And there's been some community hesitation on that around, well, if that medication's there and it's just easily accessible, what if a child gets a hold of it? Or what if somebody uses it and has a reaction to it? And again, the data and the information really shows that there are no side effects to naloxone. It really is a wonderful medication because its only impact is if somebody is experiencing an opioid overdose. But, of course, people have worries about these things. So just assuring community members that, even if a small child accidentally got a hold of it or, not even a small child, but a kid just being a kid and curious about it and used it to see what it was like, it's not going to have that impact, and that, there really have not been any demonstration of allergies to the medication or anything like that.
Mm-hmm. So it sounds like there's some misconceptions within the community that people are afraid to use it, think it might cause harm.
Mm-hmm.
That's one of the big things you guys are doing, and then us with this podcast, we're wanting to make sure that bring awareness to the fact that it is safe. It is. It's just effective when it needs to be, and if not, there's not that impact that people are scared of.
Right, right.
And people have also said, from what I've read online, that some people are afraid that distributing that into communities or having it available, like you were talking about, in the mailbox format might encourage opioid use because they see it as, let me try it, this is here to save me as a backup. So that's something I also saw during some of this research.
Yeah, and that can be a reaction sometimes. Great point to bring up. And we just remind people that when individuals are experiencing a substance use disorder, there's not anything that's going to encourage them to use, and that naloxone and Narcan really just helps people be able to continue to live and not die. And, ultimately, if they can also connect to other resources in the process, that's a great benefit as well.
Well, thank you so much for being here, Jenny. We had a great time, and I was just wondering, before we wrap it all up, just like a key message that you would like our listeners and us to know about the Narcan use and overdose prevention.
I think the most important thing is really getting past some of the stigma and the misconceptions about naloxone and recognizing that everyone should really carry naloxone. Part of the widespread distribution is that encouragement that everyone should have it. Even if you think, oh, well, I don't misuse opioids, or no one in my home does. Sometimes you just don't know. Or, we all exist in larger communities, and you could at any point witness an opioid overdose. And it's always better to have the naloxone on hand than to wish you had it and not have it. So it really is a medication that should be in every first aid box. People should be comfortable with it, familiar with it, and people should have easy access to it.
Great. I think you're doing a great job trying to get rid of the stigma, and hopefully our podcast helps as well.
Yeah, thank you all.
Thank you, Jenny. And don't forget to stream Preventable on Spotify also.
Excellent.
All right, welcome back, everyone. I hope you enjoyed hearing back from our guest speaker, Jenny. Her experience really shows us how powerful Narcan can be when it's in the right hands. And that brings us to something really important, making sure people actually have access to it. Because Narcan can't save lives if people don't have it, or if they're too afraid to use it.
That's a great point, Caitlin. So if someone wanted to get Narcan today, where would they even start? Jenny had mentioned the vending machines throughout St. Louis, but what other resources are available?
Great question, Anna. Before I get into it, I do want to let our listeners know that all of this information about resources I talk about will be linked in our show notes for easy access. When I was researching where to get Narcan, I was actually surprised by how accessible it is. What was surprising to me is that you can now purchase the Narcan nasal spray on Amazon. You can get 2 single-dose devices for about $35, and it's on sale right now. Of course, the most common way people get Narcan is going to be through local options like pharmacies, health departments, or community organizations. Most pharmacies sell Narcan for about $45. This box contains 2 spray devices, and you don't need a prescription for it, but you could still bill the patient's insurance. So some insurance companies will actually cover this, and some don't. You can also get it for free by going to www.getmissouri.naloxone.com. And again, I will post that in the show notes.
So our guest speaker, Jenny, that we heard from earlier, actually told us about a great program that was initiated by 2 WashU grads named Matthew and Danielle, who are actually engaged. Both of these students had instances in their past where Narcan was not available, despite both of them having been trained with how to use naloxone. Matthew was an engineer at WashU and worked with Danielle, a medical student, to make Nalox One, which is a soft rubber case that can hold a single dose of medication. You can have it on a keychain, you can throw it in your purse, and the case protects the Narcan, but it has it in a small little box so you're not carrying around the big bulky box you would get when you normally buy Narcan. It also has a QR code on the casing that allows users to scan it really quick with their phone to get instructions on how to administer Narcan if they're nervous or unfamiliar if the time comes. After they collected their data, Matthew and Danielle, it showed that 10% of their test subjects had actually used the case and medication to save a life. With their sample size, that meant 12 people administered the medication, 4 of whom who had never previously carried Narcan, so they only started doing it once they had these small little cases. So in the past, they wouldn't have been able to save those lives that they did without this Narcan on them. We will link the website in our show notes. You're able to purchase one for $8.95 on incastetechnologies.com. It is just the case that's sold. You would have to get the Narcan, but it's a quick and easy way to carry it around and have it on your person at all times.
Well, that's really awesome that it's becoming easier to get, and that new technologies are being developed that will make it easier to carry. But I feel like some people might still be hesitant to use Narcan or even to call 911. Maybe they're afraid of getting in trouble. Is there anything in place to protect them?
That's such an important question, Lucy. Thank you for bringing that up. There is actually a law called the Good Samaritan Law, which protects people who call 911 or give Narcan during an overdose emergency. Essentially, if you're trying to save someone's life, you are protected from minor drug or alcohol violations. I've included 2 links in the show notes for anyone who wants to read more. One from the U.S. Government Accountability Office and another from Time to Act, Missouri. These 2 laws have been shown to help reduce overdose deaths by encouraging more people to act quickly and call for help without the fear of any legal consequences. So at the end of the day, Narcan access and awareness are only part of the equation. What really matters is people being willing to act, to step in and help when it counts.
Exactly, Caitlin. And that action truly makes a difference. In fact, here in St. Louis, there was a story about a bystander who shared how she saved someone using her naloxone kit. From the website, overdoselifesavers.org, she shared how a friend called her for help and she rushed downstairs from her unit with her take-home naloxone kit. She was able to revive him with her naloxone kit before the paramedics arrived. This was one of the many times she has revived someone experiencing an overdose. Gabrielle still actively encourages people to keep naloxone on hand and learn how to use it. And that's what really this episode is about. Saving lives, breaking stigma, and reminding everyone that anyone can make a difference. Thank you so much for listening to this episode of Reverse the Crisis. Today, we talked about the importance of carrying Narcan, recognizing the signs of an overdose, and how to take action. Talk to your pharmacist, learn the signs, carry Narcan. You can save someone's life. We'd also like to give a huge thank you to our guest, Jenny Armbruster, for sharing her expertise and experience with us today. And always remember, reverse the crisis, because one spray can save a life.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.